Okay. Okay. So hopefully you can see the slideshow now. If you can't, just let me know. And if at any time you have any questions, please just feel free to go off of mute and ask your questions. I'll stop every so often to give you a chance to ask questions as well. So the radiology is really just a component of a larger course called Structural Principles, and we talked a little bit about this. Those of you, I think all of you were there at the faculty development we did a few months ago, but I really wanted to give you kind of a review of its place in the course and then dive into some more specifics so that you feel comfortable coming into the session, knowing exactly what is expected of you, what the students will have done, and how things will play out during the session. Let's see if that's going to work. Okay. So our goals today are 4 goals. First, we already went over this a few months ago, but I just want to, again, just reiterate the location of this course in the overall context of the School of Medicine curriculum. I'm going to talk about the overall structure of the lab, how it works from a functional standpoint, and the role of radiology faculty in the lab. Again, this is a new addition to our lab, and I'm really excited about it, and I think the students are going to really benefit from having you in there on a weekly basis. I want to explain how you can best prepare for sessions, and then what may be one of the most important things: where do we park? How do you get ID? So talk about these lab logistics, things that kind of, I don't want you to have to worry about on the day of. Okay, and here's the agenda. It really mimics what we just saw. So a brief review of the course, role of the faculty, preparing for sessions, and logistics. So I like to start with our vision, and you've probably seen this before. Each person in New Jersey and in the U.S., regardless of race or socioeconomic status, will enjoy the highest levels of wellness in an economically and behaviorally sustainable fashion. I'll probably give you the same line that I gave you before, but I actually do believe it. In contrast to most medical schools that I've worked at, where the vision is something that is on the wall when you walk in and you just kind of say, oh, look, there's the vision. I really think we embrace this here, and we have a whole portion of our curriculum that is dedicated to this, and even the other courses, the non-human dimension courses, really we try and keep this in mind at all times. And I think we're seeing this already in our students. Our students have an awareness of the importance of these factors in wellness and disease, which is really amazing. I think it's something that is underappreciated in medicine today. So a brief overview of our course in the overall curriculum. So you've probably seen this diagram. This is all School of Medicine curriculum. On the left side, you see the 4 years, and we have a 3-year core curriculum. So we call this a 3+1 curriculum. The first 3 years include phase 1, which is about 16 months, and phase 2, which is the remainder of those 3 years. And in phase 1, we have 2 courses going on simultaneously. We have a course called Human Dimension. That's this light blue. That actually goes on all the way through to the end of the 3rd year. And in that course, our students are paired up with families in the community. They don't act as, they don't provide any medical care, but they really are to see things from the patient's perspective, to really help them navigate the healthcare system. And I've heard some incredible stories of the experiences our students have had, and I really believe it's going to be very important in helping to form who they are as physicians. And then simultaneously, we have a series of what are called sciences, skills, and reasoning courses, these kind of dark blue color there. And these include 2 types of courses. They include foundational courses, of which structural principles is one, and then systems courses. And these are all integrated courses. The foundational courses tend to focus a little bit more on the basic science, but do include a lot of clinical science. And the systems courses, as you might expect, are organized by system and really integrate basic and clinical science together, in addition to social sciences, health system sciences, those kinds of things. After phase 1, they go right into the clerkships. So our first matriculating class they're right about here, and they are ready to start their neuro course. They're actually taking their exams for their nutrition and digestion course today, and then they will move into a transitional clerkship, move through clerkships that are relatively traditional with the exception of a longitudinal emergency medicine clerkship, and then they take step one, have a bunch of and take step two. At the end of the third year, number of options, including dual degree certificates, global or domestic health immersions, clinical immersions, research, and then the one that I think a lot of our students focus on, which is early entry into residency within the Hackensack Meridian Health System. This is really for students who are high performers. It's not going to be for everybody. We asked the students on the first day of class, how many of you are planning on doing a residency after 3 years, and almost everybody raises their hand. We asked them after a year. That number has decreased dramatically, not because of performance, but because they just know more about what they are going to need to do, in order to pursue different types of medicine. So here's phase one, and we're going to zoom in on that. And here we're seeing it again, these 16 months. We, meaning our course, is structural principles. Our students next week are going to be taking their exams. We have a summative assessment block at the end of each course. Okay, so we have this 8-week course. And I'll get into this in a little bit, but we're teaching anatomy, we're teaching radiology, some histology. It's impossible to teach the depth that we want to go into just within these 8 weeks. And so we have strategies that I'll talk to you about in a little bit on how to approach that. We drill down a little bit more onto a specific week, and this is how a week looks. So our weeks are framed around these blue blocks, these case studies. These case studies are called problem-based learning. We introduce them in a large group on Monday, break into small groups on Friday, and they really are meant to bring in all of the topics that are seen throughout the week using a case presentation. Number of different goals, one of which is so that the students understand, hey, really, why am I learning about vascular histology? What's the importance of this? And how does it potentially tie into, pharmacologic treatment of pain? Okay, so that's how these cases are constructed.
Unknown participant is now joining.
They're very integrated cases. Here are the labs. So the labs occur on Tuesdays and Thursdays, and we have you as radiologists coming in at the end of the week on Thursdays. Okay. As you can see, we've kind of split these labs. So if we have 100 students, we have slightly fewer than that. We're going to have 50 of those students in the lab from 8 to 10, slight break, and then 50 of those students in the lab from 10 to 12. That decreases our numbers. You can have smaller groups, which really is a nice thing, gives you an opportunity to engage with the students a lot more effectively. When they're not in the lab, they're going to be doing some other type of session. The other nice thing about structural principles, it's organized by regional anatomy. So here we have our abdominal week. And if we were to go down further on the page, you would see that the students are actually doing the abdominal exam. One thing we did last year was we actually integrated ultrasound as well. So very relatively basic ultrasound into about 4 or 5 sessions. Because of logistical reasons related to faculty and actually getting machines was the bigger problem. We used loaners from various companies. We're not going to be able to do that this year, although we are really making an effort to next year see if we can get a large number of handheld ultrasounds, which will really be great. So that's something that will hopefully be coming in the future. Okay, so just going back to the question of how are we supposed to teach all of this content in this 8-week block? Here's our abdominal section, right? We have a week on abdominal anatomy. There's no way we can teach all of the important abdominal anatomy and histology during this 1 week. So what we do instead is we consider this to be a first exposure, and then later on in the nutrition, metabolism, and digestion course, we find different places where this content weaves through appropriately. So as an example, students might learn about basic structure of the liver in structural principles. And then maybe later on in nutrition, metabolism, and digestion, they're going to really dive into the idea of portal-cable anastomoses, the clinical manifestations of these, and the pathways that could potentially lead to these. So that's just one example. Okay, so this is a really important slide, and I think if there's anything I want you to get out of this session, it's this. I just want you to remember where our students are in their education in medical school. So this is their 4th month, right? They have a long way to go. The vast majority, and I would say, just guessing here, but probably 95% have no prior experience with learning medical imaging. They've probably had an x-ray, but they've probably never had an opportunity to take a look at one. It looks like a blur of black and white to them. So really keep that in mind, okay? It is not our job at this point to teach them everything they need to know, when they are an intern about diagnosing a chest pathology based on a chest x-ray. It's just we really want them instead to be able to approach a chest x-ray and have some idea of, how to approach that, how to figure out, okay, what am I looking at here? How do I even orient myself? What do all these colors mean? Okay, and it seems very simplistic, but we really are, that's where we're aiming for. So in some ways, I think, I see a lot of our clinical faculty who are teaching anatomy, our surgeons get very nervous about coming into the lab and saying, oh, I need, what's the level I need to teach these students at? And then they start to realize, okay, we're teaching this at a relatively basic level because the students are going to see this again. So we'll give you guidance on where we want you to go, but we don't need to be teaching them really too much at this point about diagnostics. We're really focusing on basic image interpretation. So again, teach the level of a first-year medical student, and they will have chances to see this again. Okay, so I'm going to stop there and see if anybody has any questions. Okay, so I will keep on going. So how is the lab actually formatted? And what is your role as a radiologist going to be in that lab? So let's talk first about the format. There are 2 types of activities happening simultaneously. We have relatively traditional dissection, and we have a large number of clinical faculty members ranging in disciplines from plastic surgery to internal medicine to family medicine to orthopedics. Really, we were able to recruit a lot of different types of clinicians and radiology instruction. So this is the new addition this year. As I said previously, the lab is made up of 2-hour sessions. It's really about an hour and 3/4 with a break in the middle. We have half the students in during Group A and half the students in during Group B. The teams work on cadavers in groups of 7 to 8 students, but remember, only half of those at a time. So they're only going to be about 3 or 4 people on a cadaver at a time. And in order to make sure that Group A or that Group B knows what Group A did, there is a verbal handoff that happens in the middle of the session between these 2-hour sessions. So I'll show you a schematic of that. Here we have our 3 students from the table, Group A, dissecting for about 1 3/4 hours. They do a handoff. This is a verbal handoff we've developed. Then the 3 students from Group B dissect for their 1 3/4 hours. And then these Group B students need to tell the Group A students what they did. So it is their responsibility after hours to give another debrief. Okay, so B knows what A did and A knows what B did. And, as you would expect, and it was probably your experience, students will spend a lot of time in the lab after hours. They have 24-hour access. So this year we've also kind of firmed things up a little bit in terms of the responsibility of our anatomy faculty and the clinicians teaching anatomy. We have them assigned to very specific sections of the room, and you'll see in any specific section you'll have a green line, which is a clinical faculty member, and a red line, which is one of our anatomists, either me or one of our 2 other anatomists. And that's our job, is to really cover these areas. And we have similar types of guides that I'd be happy to provide you with as well. And then down at the end of the lab, we have 2 radiologists per session. You are the chest x-rays, stationed at the end of the lab. Okay, so how is this going to work logistically? During each of these 2-hour sessions, you will run 3 identical rotations. So you'll have students come over for a rotation. I'll tell you in a minute. It'll be about 20 minutes. You'll send them back. You'll have another set group of students coming over. And you'll do a little rotation. And then you'll have a third group of students, and you'll do a little rotation. Okay. The second radiologist will have the same thing. And there'll be approximately 6 to 8 students per group. And so those students will come not all from one group at a time, because we want the students to make sure that they're still actually doing stuff, and that there's not kind of a ceasing of activity. So we might pull, one student from each of 6 groups here, one student from each of 6 groups here. Okay. And we'll take care of that. It won't be your responsibility to kind of wrangle the students. They should know when they're moving over. So what are these mini sessions going to look like? There'll be 20-minute small group sessions composed of 3 parts. So the first part is basic instruction about different modalities. Like I said, these students, the majority of them, don't know an X-ray from a CT scan, from an MRI, or they may have some idea, but they really don't know what the use of these different modalities is. And so that's our first goal for you in this course, is to help them understand why we use different modalities, how they look different from each other, how they're interpreted differently. We're not going to be getting to, an extremely deep dive on things like, flare MRI, or, we may do a little bit on contrast enhanced imaging. We would probably do something like T1 versus T2, or X-rays one week, focus on CT scans the next week, and then maybe the next week let's do CTs with contrast. So you get the idea. We're really focusing on relatively basic types of modalities. When they get to their neuro course, they're going to be seeing MRI in every single form possible. So it's really not going to be something that we need to worry about. We want to really just prep them for that when they get to it later in the curriculum. So that's goal number 1. Goal number 2, we want to use the imaging studies that we'll have for you, and I'm happy to, I'll give these to you, but if you find better ones or think that there are different approaches we can take, I'm very happy to work with you to modify things. And we want to use these studies to link to the anatomy that they're doing that day or that week. So remember, you're coming in at the end of the week. If you're coming in at the end of the abdomen week, they will have done stuff on Tuesday as well as Thursday, and they're going to, so you can really tie into all of that material. And then we'll do a very short case study. So this is it's a good amount of stuff to do in 20 minutes. We have built in a little bit of flex time, but time management is going to be something that we're going to, really want to watch. I'll be giving you time warnings over the speakers. But like I said, there's a little bit of flex time, right? 3 times 20 minutes is an hour. If you built in 5 minutes for the students to rotate back and forth to your station, you're still well under an hour 45. So we do want the students to maintain a good amount of time at their dissection tables, but we also want to, balance that with the time in these radiology sessions. Okay. So the students will come to the session having prepared. They'll do a brief reading, and they'll view an imaging study. And when I say a brief reading, I mean really pretty brief. So it might be a 10-minute video. It might be 3 or 4 pages in a textbook, and they may need to look at a lumbar study and X-ray, and just identify some of the structures, or look at some identified structures that are on that in a week that we're doing the spine. And I'll go through an example in a second using that same region of the body.
Pranav Shah
is now joining.
So your role here is to help them learn. Hi, Pranav. We have all this, just so you know, we have all of this recorded as well, so you can listen to it later. So your role
Pranav
here
Shah
is now exiting.
Okay. So your role here is to help the students learn, and the primary way that we would like you to help them learn, is through questioning. Um, I've worked with a lot of faculty on these small group type of stations, and the difficult thing, the most difficult thing for most of them, is to move away from wanting to lecture the students about content. Um, you have so much to contribute to the students and to their learning, that it's really easy to fall back into that mode that I think many of us learned in. But what we are really trying to focus on is engaging the students, making the students think, right, and using the information that they're coming in with to really apply that to various types of questions. So the best thing you can do is ask questions. I typically tell faculty who are running these type of sessions that you shouldn't be speaking more than a third of the time. You want the other 2/3 to be students working together in a small group and answering questions that you've asked them, or talking to each other. And again, I'll give you some examples in a second. And use Socratic methods. So when and this is something you've probably all done on rounds with students or in various situations. When the students respond with an answer, you can always push for more information. Say why. So you say to the student, where do you? I'd like you to find a structure in both the lateral view and the frontal view. And they say, okay, here it is, and here it is. And you say, okay, why? Justify that to me. Tell me what features of that structure demonstrate that it is the same in those two views. Okay, so keep on pushing them. Okay, so let's get down to an example. And I'll use a sample session from week 1. And week 1, students are in the dissection portion of the lab, dissecting back musculature. They're performing a laminectomy, exposing and
Is now joining.
dissecting the spinal cord, and they'll be learning the bony anatomy of the vertebral column as well. Okay, so this might be a study that we use. We're going to use just a very normal AP lumbar spine and a lateral lumbar spine. Okay, and we'll use these for those first 2 parts of the session. The first part where we talk to them about basic modalities, X-ray and what it means and what these different colors are, and we might use it for linking with the normal anatomy. And so let me give you examples of that. So I'll move those over there. So part 1, instruction about modalities. So this is an example of how I might run this portion of the station. And we don't have much time here. We're probably talking about 5-7 minutes, something like that. Very quickly, I would explain to the students what they're looking at, giving them some basic orientation. You're looking at frontal and lateral views of the lumbar region, and I would describe in very general terms how to approach an X-ray, not necessarily specific to a lumbar series, but maybe thinking, okay, I find structures that I know, I use those as landmarks. I look for things that are regularities, and if there are things that are different. And again, we'll give you some guidance in terms of that, but you can use your experience as well, just making sure not to really focus too much on the specific region, but focus more on the modality in general. And here are some different questions, and we'll provide you with these, but you can add your own. So we may say to the students, I'd like you, on an X-ray, there are structures of different, there are structures that are represented by different colors that represent different densities. I'd like you to point out some structures that demonstrate different densities. What types of tissues are these potentially, and how do they appear on the X-ray? Okay, so our goal there is pretty simple. We want them to be able to understand that there are things that are dense and there are things that are less dense, and things that are less dense are going to be dark, and things that are more dense are going to be white or light. We can introduce some basic terminology, radio opacity, and the idea that, okay, here we have some air. Why would there be air there? This white areas, this is probably bone. Why do we have this really bright white rim here? What does that represent? Okay, well, we have this structure and we're flattening everything out, so we're probably looking at a very dense area, or an area that's represented by areas of bone that are superimposed on each other. So another question, let's find an area where structures of different densities are superimposed on each other. How do you distinguish them from each other? Okay, looking at contours of different types of structures. And then we might say very briefly, pick any structure and find that same structure in the frontal and lateral views. Okay, so let's pick a vertebrae. Let's count and pick the same vertebrae and find it in the two different views. So really very basic stuff. We haven't really talked at all about the lumbar region because at this point, that's really not what we're focusing on. Okay. And so any questions on part one, on what the goal of part one of the station is? Okay, so I'll move on to part two. So part two is linking imaging and anatomy. So linking the imaging studies, and again, we'll use that same very basic imaging study with the anatomy that we're doing that day. We'll have I didn't mention this, we'll have large screen monitors for you to use, and we'll provide the students with the imaging study on the monitor, as well as a bony vertebral column. And you could say very simply, I want you to correlate the following structures in the frontal view, the lateral view, and with the bony vertebrae. And we'll have a list: vertebral bodies, pedicle, transverse processes, spinous processes, intervertebral foramina, and so on. Probably a list of 8 to 10 structures. This is a really nice time to give them this question and then just step back a little bit. I really like to do this with the students. You know, it gives you a little bit of a chance to recharge, listen to them, and listen to what they're saying, and let them do the work. Right? They should be able to point to a lumbar series, and they should be able to pick this up and make those correlations. And then you can take a couple minutes at the end going through these. You know, if we have 8 questions and 8 students, ask one, or 8 structures and 8 students, ask each of the students to do this on the lateral or on the frontal view. Okay, you can even take the I like to do this. You can actually take the bone and hold it up to the x-ray like we're showing here. I've done this with coronary angiograms where we had hearts that were dissected out. You know, the angiograms tend to be very difficult for students to interpret just because of the nature, because they're flattened images. You know, it just doesn't, from a geometric standpoint, it's difficult for them to wrap their heads around. But when you take a heart with those arteries dissect it out, you hold it up to the screen and rotate it around, they can really start to see how there's a correlation between what they're seeing in the imaging study and what they're seeing on the actual specimen. Okay, so that would be part 2. And then part 3, a brief case study. And I just picked one out relatively quickly here. This is an L1 compression fracture. And we're going to give a brief case study. We could probably find a better one here, and we probably give them a lateral as well. A 40-year-old man fell approximately 6 feet from a ladder, landing on his coccyx. He was brought into the ER complaining of severe pain in his lower back, as well as pain radiating down his lower extremities, more on the right than the left. And then a very simple question. Based on the mechanism of injury, the imaging study, and his symptoms, what would you suspect is injured? Can you identify the damaged structures? Okay, so we're getting into some very basic understanding of normal versus pathologic, starting to get that that pattern recognition skills going for these students. That, okay, I see all of these vertebrae that look pretty normal, and now I see one that looks a little cockeyed or something's a little strange with it. This is going to be hard for them, right? They're not that used to looking at these, so I would expect you're going to need to give them a little bit more guidance, and we're going to try and choose studies that are relatively simple, just because, when you look at an imaging study, it's pretty obvious right away where the pathology is. When a first-year student looks at it, they have no idea. Everything just looks like a mass of white. So we really want to help them along here and promote those very early diagnostic skills. And then we might ask them another question. So, we understand why their lower back might be hurting, but what's the explanation for this radiating pain? And then now again, we're linking into the idea that they are studying anatomy of the vertebral column. They understand that there are all of these roots and rami that are extending out and going down to the lower extremity. So any kind of compression or fracture can put pressure on those, causing pain in areas away from the initial injury region. Okay, so those are going to be the three main components. Any questions on what the station should generally look like? Okay. So what do you need to do? Faculty pre-work and preparation. So in order to prepare for lab stations, you'll need to do a little review. So first of all, we will provide you with learning objectives. These are the guideposts for what students should know. So they'll be something like describe the appearance of basic types of tissues on a plain film X-ray, something like that. They'll do pre-work, and this is going to be, like I said, very brief reading or video on different modalities. Potentially, they'll look at a very basic labeled structure or labeled study. You should do this as well, so you know what they're coming in with. We will give you a faculty guide, and that will provide links to these materials, and we'll give it to you about a week or two prior to the session. Okay, the review should not take us too long. I'll get there in a second. In addition, once you've done that pre-work and you've seen what the study is and given feedback, and we might modify it based on your feedback, I'd like you to think about the questions that you're going to ask. Okay, so write down on a piece of paper the questions related to the modalities, linking between the imaging studies and the anatomy, and questions related to the case study. And it shouldn't take you too long. Really, no more than an hour and a half to 2 hours prep before the session, and potentially less. The good thing and the bad thing. So the really nice thing about doing remember, you'll do this station 3 times for the first group and 3 times for the second group. So we actually have a faculty development specialist who's going to be in the lab observing you on one of those first go rounds. And so it gives you a chance to, really get some feedback. And, I found that, in the first or second time, you're kind of finding your feet when you're doing one of these stations. The third and fourth and fifth, you're really kind of hitting your stride. And then the sixth, you're like, okay, I'm about ready to go home now. But getting to do it multiple times is really, I think there's a benefit for that, and it helps to refine that station. I've worked at places where we use a similar type of strategy, and I've had to run stations 8 or 10 times, which is a lot. I think 6 is a number that is doable, and you don't get too tired. But definitely put in a little bit of time prepping before the session. Okay. And then the final thing I want to talk about is logistics. So first of all, accessing resources. So you may need to access the library and our course management system, some of the course resources. If you do have trouble with that, I'm always going to encourage you to go to those systems first, because it's the easiest way. We do have other ways to get you materials, but that's really what I would suggest as kind of the first attempt. In order to do that, you will need to get something called a Seton Hall campus-wide ID. So I know a number of you are kind of in the various steps of receiving your faculty appointment. It has been moving along, and I don't see any issues with any of our faculty actually being approved for teaching. But one of the things you'll need is to get this ID number. That should come to you from the Office of Faculty, and it will give you an email address, and it will give you library access. Once you get your appointment letter, you should actually get that information. And if you have not received your appointment letter by the time the course starts, it doesn't mean you can't teach. We can make sure that as long as you've had your background check, that you can get in there, and we'll make sure we find other ways of getting you the materials. But I've been checking up with the Office of Faculty on a relatively regular basis, and it seems like people are moving along. If you have a campus-wide ID but don't remember your username or password, please call Seton Hall IT support, and they're very good at helping people get those reset. Okay, the most important thing, parking. You must have a valid parking permit. They have been ticketing people. It doesn't matter if you are, a student or Bob Garrett. Actually, Bob Garrett doesn't get tickets because he has a reserve space. But If you park in the wrong lot, if you don't have a permit, they will ticket you. And I really do not want to see any of our faculty who are coming out here volunteering their time and putting energy into this getting ticketed. So I'm going to give you some instructions on where to park and how to get a permit. So two options for permits. If you're a person who will be on campus often, if you're running small group sessions, doing something else like that, you can actually get a permanent sticker. And all you have to do is provide the name of your primary hospital if you would like to do this. If you're just getting a day pass, or if you're not coming here very often, if you're coming here once or twice a year, then we will send you a day pass prior to your session, and those should be out probably beginning of next week. We'll send that to you. It'll be a PDF. It is your responsibility to make sure that you print that out and place it on your dashboard. If they don't see it there, they will ticket you. I don't know if I haven't actually had any faculty who had a pass, didn't put it on there and got ticketed and then tried to fight it, but it's just a pain. So just make sure that you print out the pass that we send you and place it on your dash. Okay, so just as important as how you get a permit, where do you actually park? So for those of you, I think most of you have been at the medical school. This is the road, Kingsland Street, that runs right in front of the medical school. Here's Route 3 back here. You can get onto campus either through Route 3, and on Route 3, there's kind of a very quick little entrance here that you have to slow down rapidly to get onto, or via Kingsland Street. The main entrance to the entire campus is currently shut down because they're doing construction in these two buildings. And so you can't go down Metro Boulevard. So if you're coming down Kingsland Street, you're going to pass by the School of Medicine if you're coming from the west. And just as the street starts to curve around, and you'll see the Center for Discovery and Innovation over here, this triangular shaped building, you're going to make a left onto Ideation Way. There are two general areas where you as a faculty member, me as a faculty member, really anybody but a student are permitted to park. Okay, so in the back, there's an area called lot number 3. Okay? There are some numbered spaces over here that we are not permitted to park in, but I'll get into in a minute where you should park. There also are some not so secret parking spaces. So as you go into Kingsland, on Ideation Way and on Medicine Way, before you would go into the student parking lot, which is off limits, there are a series of parking spaces here. I got in at about 7:25 this morning and was able to grab one of these. It makes it a much shorter walk. It's about 2 minutes to the front door of the School of Medicine. So as you drive in, always take a look and see if you can grab one of those. As you go up Ideation Way, once you pass the Center for Discovery and Innovation, there are a few more back here as well that you can park in, and then you can just walk down this direction towards the School of Medicine. Okay, so you're going to come in to Ideation Way. You can try and find some of these not so secret spots. If those are all taken, you're going to head up Ideation Way till it hits a dead end, make a right. You're going to make a left down a little decline, and then go all the way to this portion of Lot 3. You'll see where all the cars will be, and you'll see a little bus shelter as well. We do have a shuttle that goes every 15 minutes, I believe, but usually it's just faster to walk than wait for the shuttle. And we're not going to be hitting into too nasty weather during the duration of this course. From Lot 3, you need to walk around to the front of the building and come in to the front doors of the School of Medicine. Okay. How do you actually get into the building and get to the anatomy lab? So at this point in time, all you need to do is show a valid HMH ID card, and that should get you into the building. Now, I know a few of you are going to be adjunct faculty and may not be HMH employees. That's not a problem. We will also enter you into the system. It's called Envoy. So you'll walk up and say, I'm here to teach in the anatomy course. You'll show them your ID and you will be already entered into the system, and they should let you in no problem. If you ever run into any problems, please, you can just call me on my cell phone and I'll give you that number at the end of the webinar. Okay, so you're going to go to the second floor and head east. If you've come up the main stairs, that will be to your left. And if you came up the elevator, it depends what elevator you came up through. So either way, you will go east and pass by the blue colored wings on the left and the right. Many of you had a tour already of the anatomy lab, and you will go through the set of double doors. Once you go through those, you will see a bank of lockers. You can make a left, and there will be a changing room for use by faculty. There will be somebody outside the lab, either Laura Roundtree, who is our lab manager, or one of the core faculty members, and we will be able to let you in. So when to arrive? Make sure to give yourself about 10 to 15 minutes from when you park to get up to the anatomy lab. It always takes time to walk to the building, to get through security, to realize that you've gone left when you should have gone right. It's a little confusing up here, so give yourself a little bit of time. We're going to ask everybody to arrive by 7:30. We like to run a pre-lab session from 7:30 to 8 to help orient people, make sure they're comfortable at their station or in their area. It'll be good to connect the radiologists with the other clinicians who are helping with the dissection, so you can really tie in your content as well. The lab session runs from 8 to noon, and as you saw, there's a short break in the middle. And if you're available, we'd love to have you stay for an extra 10 to 15 minutes after the lab in order to do a short debrief. Find out, what did the students know, what did they not know, where did they struggle, how can we improve this in the long term for the next year, and how can we improve this in the very short term. We definitely are very open to making rapid changes in the course. Last year, we realized about 2 weeks in that the students were drowning because of the type of pre-work that we assigned. So we switched things up dramatically, and it made a tremendous impact on how the course was received by the students and how they learned. So really, any feedback you can provide would be great. It's just some lab protocols. Um, this shouldn't come as a surprise. You're in an anatomy lab, so don't bring in your coffee. No food or drink. You can wear what you're comfortable in. So at the end of those 3 rotations, there is an opportunity for you, if you'd like, to actually help at the dissection tables if you feel comfortable, or to walk around and just talk with students a little bit, because as I said, we've built in a little bit of extra time. We have faculty who wear all kinds of things. We have some who wear scrubs. We have some who wear suits. And just recognize that there may be a formaldehyde smell when you leave, but we do have lab coats and pretty much any personal protective equipment that you'll need in case you don't wear scrubs, or if you are wearing scrubs and want to wear an apron over it. We have gloves, aprons, booties. You probably will not need most of that because you're not going to be interacting too much with the cadavers, but again, it's there if you need it. And we do have lab coats, if I didn't mention that. Okay, just a couple of additional points. As I mentioned, we will be providing you with formative feedback regarding teaching strategies throughout the session. We have our Director of Institutional and Curricular Design, Beth Colts, who will be there. She'll be watching you and kind of standing behind you, so don't get nervous. She's not there to critique you or to report back, how you're doing. She is there purely to help you and to provide formative feedback so that you can improve the experience for you and improve the experience for the students. Another thing that we wanted to mention, we have 2 students this year with physical disabilities, one who has visual and auditory impairments and one who uses a wheelchair. We worked really extensively with these students and with disability services to make sure that they are comfortable in the lab, they will be able to participate in the lab. So we just wanted to make you aware of them so that, so that nothing came as a surprise when you came into the lab. A few other people that you will be seeing and talking to are 2 other core anatomists, Anthony Pagano, who's an assistant professor of medical sciences, and Michelle Tatinuk, and this needs to change. She's actually an assistant professor as well of medical sciences, both trained anatomists, excellent anatomists, and they know their stuff. And then Laura Roundtree, she's a licensed funeral director and is our anatomical lab manager. So she manages all the logistics of the lab. She's also going to be instrumental in our anatomical donor program that we're starting up, which will help to eventually match anatomical donors with us so that people can donate their bodies for use at the medical school. Okay, so the final thing I had was me. Here I am. Here's my contact information. Best way to get a hold of me is email, and then probably cell phone. I have less success at checking my office phone, so those are the two best ways to get a hold of me if you had any questions. So that's all I had, and I'm happy to take questions from anybody who has them.
Sounds phenomenal. I want to go back to medical school.
No, I think it'll be great. I'm really excited to have all of you in. I think it's going to, like I said, add a tremendous amount to the course. Any other questions or concerns that anybody had?
Hi, this is Pranav Shah.
Yes.
Hey, what is the timeline for obtaining the IDs and just for the logistical purposes of getting in and out of the campus?
Yep.
I might be behind myself. I really am not in that loop just yet as far as library access, ID, and card and all that stuff. And I think my first day is coming up in September.
Yeah, so I think you're actually, if I recall correctly, you're actually on faculty, but I don't think you were cleared to teach because of the background check. Is that correct?
Yes, and I had taken care of that last week. I don't know how long the background check, actually 2 weeks ago.
Yeah,
so I don't know how long that takes, but I can follow up certainly with whoever I need to make sure that's been all done.
Yeah, so you shouldn't have to worry about that. But if you ever received an email from the Office of Faculty saying, congratulations, you are a faculty member, and I think you did, correct?
I did initially
Yep.
a couple of years ago.
Yeah,
Yes,
and
first one.
So you're still on faculty. So all you need to do is to get your campus-wide ID. Basically, you need to you have that already probably. What I would do is I would start off calling the Office of Faculty, or you can email them. I think it's somfaculty@shu.edu, and say,
Yes.
I'm a faculty member. Can you just confirm what my campus-wide ID is so I can get library access? And other than that, you should be set. I mean, just getting into the building, you will just need to show your HMH ID card, so that shouldn't be a problem. And I'm really going to, I know many of you were kind of getting faculty appointments fairly recently, so I'm going to do everything I can to make sure that the materials are accessible to you outside of the library resources if possible.
Okay, thanks, and I'll follow up with the Office of Faculty. That'll take care of it, I'm sure.
Yeah, they should be able to help you. Yep.
So
Okay,
Keith,
thanks.
similarly, I'm even a later joiner, so I haven't gotten any letter or anything. Do I just email them because I don't have, obviously, the campus? I haven't gotten a letter from them. I don't have the ID, and in terms of parking, I'm not affiliated with any hospital.
Yeah, so the parking shouldn't be a problem. We can get a parking permit. I can get it for anybody, and they just print it out. So they'll get that up for you. That shouldn't be a problem. In terms, really the requirements from the school and really from the provost office at Seton Hall is they want to make sure that anybody who is in contact with the students has had a background check. And so what I will do is I will check on the progress of yours. I believe that you are probably stuck at the provost desk, which is the last step. We tend to find ourselves stuck at the provost desk quite a lot. And the Office of Faculty can basically push things and say, hey, we have somebody teaching in a week. You need to take a look and approve them as a faculty member, and from there it's really not a problem. So don't be too concerned about that. Parking, there's no concern at all. We can get you the piece of paper that says let this person park, and we'll make sure on our side that things are moving along. I'll be checking up on all of you today.
Oh, that's great, because we also, and how would we, the background check I did months ago, so that
Okay.
I'm sure they have, but in terms of then accessing the slides that you're providing, is that also we need the campus-wide ID for that too?
Nope, you probably will not need that. I will probably just email those directly. We could have you actually use your campus ID to get into our learning management system. What I found is that it's just easier to email them. So I will probably either email them or I'll post them on Dropbox so that you can access them like that.
would it be helpful to you then if I follow through and email the faculty office also just to let them know, or I don't want to impose, I just want to do the right thing?
Yeah, let me check and see where you are, and then we will. Then, if you need to, I'll ask you to do that. But I think we should be okay. But like I said, I will kind of
Thank you.
get a status report for all of you.
Thank you. Sorry for taking the time up.
No,
Sorry.
no, absolutely, no problem. Okay, any other questions that anybody had? Okay. Well, listen, I wanted to thank you again for your time. I know it's early. And for those of you, I think it's Mitch and Ruthie, for those of you who are in week 1, you should be expecting materials, within the next week or so.
It's great. Thank you so, so much.
Okay. Thanks, everybody.
All right, take care.
Thanks very much.
Great.
Have a good day, guys.
Have a good day.
Bye-bye.
Multiple people